Hello there, and welcome to Q&A video number 5. This series has very quickly become my favorite series. I love answering your guys' questions and helping you understand what's going on with you more. The reason this is important is because if we can understand our pain and have pain explained to us in a better way, it's called pain education, then believe it or not, our pain will actually reduce, and that is shown in research right here. So that is why these Q&As are so important to me because I know when I was going through the pain of CRPS, if someone could have explained it to me in a way that was simple for me to understand how to move forward, it would have made the world of difference. So I hope that you guys have been finding these helpful. Please continue to put questions down below on this video on YouTube or on the online course if you're seeing it there. And also, please put questions down below on Facebook when I ask on my post in my group, The Window Pane on Facebook, for questions each week when I start to make these videos. So let's just jump right into it. I have my coffee with me, and I'm going to try to do it in one take as usual. So if you see a jump cut, it means I failed. All right. So, first question, Sandy says, I see a comment about mind over matter. How were you able to do it, and how long did it take? I've tried meditation, breathing exercises, turning to Jesus, therapy, exercising, etc. I have focused on the CRPS and pain for so long, I'm struggling with this. My anxiety and depression from CRPS and life circumstances are big obstacles. Okay, Sandy, so I feel ya. I think that CRPS itself steals a lot of our identity away from us. It makes life and moving forward very difficult. And so what I ended up doing myself is I thought to myself after so much time being in pain, I thought to myself, what makes me, Chase, me? What are the qualities about me or the activities that I like to do that make me feel more like myself and separates me from the pain itself? And I actually made a list of those, and that is the inspiration for my better document that you can see here, that I have people in my online course and in my private coaching complete. And I use that document as a lighthouse, kind of a guide for me to move forward. And I said, if I'm going to be in pain like this, regardless, I've tried everything and feels like the pain's never going to go away. How can I move towards being myself again? So that would be my advice to start moving back towards what makes Sandy Sandy. Is it painting? Is it photography? Is it hanging out with your grandkids? And start doing those things more. And believe it or not, as we start to do that and we start to uncouple from the fixation and catastrophization of having this pain, the pain will actually begin to come down. Is this going to be something that's super easy? No. Is it going to take a lot of practice? Yes. We've dealt with CRPS for a long time, and anxiety and depression are hard things to overcome. But even if you remove the pain of CRPS and you think about anxiety and depression, that is also the process. Doing things that bring us joy, things that calm our system, and that is how we move forward. So we'll apply that here. And if you want, go ahead and pause the video now and you can fill out that better document as an exercise to help guide you forward. A lot of times it's very hard to feel hopeful, and I feel like this better document is really helpful to give you an image of what you might be like when you are quote unquote better a year from now. Okay, so that's the heart of the exercise. So I would encourage you to try that out and see if it doesn't make a difference. Okay, so Diane, our lives are turned upside down when we were diagnosed. The pain is unmanageable, and we have to figure out how to move forward with this. I had a purpose before, but since getting sick, I feel completely worthless. How are we supposed to live li our life like this? If we can't work, how do we live? This disease is so isolating. So, Diane, I would actually suggest the same thing to you. Using that either the document I just shared with Sandy or some other thing to identify what could give your life and you purpose and meaning. What right now, not saying forever, could you do, even just today, to feel accomplished? It might be something as simple as taking the time to make the bed or cleaning up one room in your house or doing one dish that's been in the sink for a while. Just small things each day to start building up to improvement. Remember my concept of 1%, and I'll show that graph here. 1% better each day leads to 37 times better at the end of a year. So just imagine what 1% can mean. Is that we take a shower today, or we fold a few pieces of laundry today. That's all 1% is. And so if we can stack that and start to compound those effects of 1% over time, you'd be surprised how different life starts to look, even while we have this pain. Remember, this doesn't have to be forever. And for many, many people, it's not. In fact, here's this statistic right here. So this is very possible to start reducing our pain and moving forward. And oftentimes it starts with 1% and defining what better looks like for us. Okay, Jane from New Zealand. She says she's been following my videos and Q&A. Great insights. Thank you so much, Jane. Dislocated her left ankle and had several fractures in November of 2020 from a fall. In my former life, I was an endurance athlete, competitive triathlete, and latterly off-road runner. Wow. Classic high achiever in all aspects, as most of us are. My question is with weight bearing, why does my ankle foot lose its range of motion when walking? It is the one activity I'm still finding difficult. I'm swimming during the week, aquatherapy. Even this stiffens my ankle when I try to kick. I have dystonia and wicked spasm. Surgeon has suggested Botox so I can have some physical therapy. Comments and thoughts appreciated. Yeah, Jane, I don't have any problem with Botox. Botox does take a little bit of time to work in the system. So if you get it and then right away you don't feel improvement, don't worry. The toxin has to kind of take hold. That'll relax maybe some of the muscles that are tightened up and calm things down. And it helps sometimes for dystonia. What I would say is when you're swimming and doing aquatherapy, you don't have full weight bearing because the pool makes the weight less given the fact that you're partially floating. So what I would actually encourage you to do is start moving towards weight bearing more often outside of the pool. And if you need to control the dose, you can uh, use your arms on the kitchen counter or something like that to do activities in weight bearing. One of the things that I have people do a lot to get used to weight bearing is holding both their hands on the counter and then having their feet kind of staggered like this. And then what you're going to do is you're going to move yourself forward and back with your feet and then swap, same thing, forward and back using the counter as a balance position. You do that a few times, and then you also stack your feet like this, and then you can move forward and back in that position. You can also, instead of moving forward and back, you can move side to side like that, and it's getting the ankle used to those positions. If that is too easy for you, you can get other things to strengthen the ankle. If you can tolerate touch, you can get a tibial exerciser, which is right here, for a single foot, and you can do circular rotations with that, with weight or without weight. You can also get a like an ankle balance board or a Bosu ball to work on strengthening the ankle stabilizers. All of those things are going to help you build up to weight bearing in a more tolerable fashion. Larissa, hi Chase. I was diagnosed with CRPS in 2023 after an avulsion fracture on my left third toe. I've done several treatments, etc., and have had 30 to 40% of my pain relief from LDN. However, I still deal with redness and flare-ups after too much activity going on in warm weather. Being in a warm environment and a warm shower water bothers me. I have to keep my foot out of the shower or it will cause a color change while showering. I also have the random cold feeling in the left side of my limb. My question is, will doing desensitization techniques help, or do you have any other advice suggestions? Thank you. Yeah, Larissa, desensitization will help, but it's going to be a different version of desensitization. So I want to encourage all of you watching this to apply the KISS method, and that is keep it simple, keep it simple, silly. Okay, the KISS method. So I want you to keep it simple here. If you have trouble with touching your limb, then you need to touch your limb in a calm and safe way and over time building up to more challenging things. If you have trouble with pressure, you need to apply pressure to your limb in a safe and gentle way, and over time building up to more and more pressure. If you have trouble with temperature, whether it be hot or cold, we need to apply temperature to the limb and build up and up and up in a calm and safe way. So, with your situation where you're having trouble with heat or warm water, what I would suggest is you pick up one of these pedicure spas and you start with lukewarm water or room temperature water first. And then when that gets easy, you start with a little bit warmer water and a little bit warmer water and a little bit warmer water. And what that's doing is it's desensitizing and acclimating you to warm water in a controlled environment. Eventually, the more that you do that, the easier it will become, and the less irritable the warm water will be for you. So give that a try. Those pedicure spas aren't too bad on Amazon, I think, and let me know how it goes. Nancy, what are your thoughts on va the shingles vaccine? Oh, sorry, vaccines, mainly the shingles vaccine. Will that have an adverse effect because CRPS and shingles are both nerve related? No, I don't see a vaccine technically having an adverse effect, but it could be, irritating to a system that is already very overloaded. So the way I like to explain this is let's consider a house, okay? And let's consider a house that has, a base level security system. And in the neighborhood, recently you've heard about some break-ins, okay? You saw it on the news. There's been some break-ins kind of near your home. What are you going to do? Well, you're going to upgrade your security system. You might add an extra camera, an extra motion sensor, etc. And then, as the weeks go on, all of a sudden you hear about a break-in directly from your neighbor. Your neighbor's house got broken into. Well, then, if you're in Texas, you already have these, but you're going to get some guns, maybe. You're going to add some lasers. You might get a guard dog. And then additionally, if you have another break-in or you see someone in the bushes, like walking around outside, then we might be adding booby traps. We might be upgrading our cameras even more. We're adding more motion sensors. We're building a moat around our house. And we upgrade and upgrade and upgrade our alarm system until even stepping out of our bed sets off the house alarm. That is very similar to what's going on with our nervous system when it comes to CRPS over the years when we've had life trauma, okay, even childhood trauma, or we've had deaths in the family or difficulty with relationships, or our sister stopped talking to us, or our job was extra stressful. We have upgraded and upgraded and upgraded our alarm system. And then getting into the medical side of things, we've been told a lot of scary things about CRPS. We've been told that, you have the condition, good luck. We've been reading things online about what might be happening to our bodies that scare us as well. And internally in our nervous system, we have upgraded and upgraded and upgraded our alarm system. So now, when there's any semblance of a break-in, we might get extra pain. And so, with a vaccine, that is an injection. Okay, that's technically a break-in to your body. It's breaking in, and our body is uh, reacting. The alarm system is reacting to that break-in. A surgery is also a break-in. An injury is also a break-in. And then someone being extremely mean to us could also be a break-in, depending on how sensitive our alarm system is. So the way that we uh, help, not have that reaction when it comes to a vaccine is we do our best to calm that alarm system, to desensitize our system. And we can do that a variety of ways, which I share in this video, re-explaining pain. So please check that out. Calm it down as much as possible. And then most likely, if we're in a very much more calm state, when we go in to have this vaccine, nothing will happen. We'll just have a normal response, just like anyone else getting a vaccine. Okay. Lessa, I would like to know why my hand stiffens each night. I know how to loosen it in the mornings, but when I wake up, it's like a tight claw, like thickening concrete. Thanks. Trisha said, good question. My foot tightens at night too. Yeah, so if we're not moving very much, we're going to be a bit more stiff in the morning. We're going to be even more stiff in the limb that is dealing with this pain of CRPS because of the way it's responding from a blood flow standpoint, with the color changes, etc. This is just part of it. And I know that's not your favorite answer, but really in the morning, loosen it up and continue on. Over time, this will stop happening. As we start to relax our nervous system, as we start to downgrade our alarm system, less and less and less as time goes on, you will wake up with it less stiff and less stiff. Okay. So great question. But yeah, if you're not moving, if you're staying in one position, your whole body is stiff. And then that particular limb feels extra stiff because that area of the alarm system is the one that's hypersensitive. So you're probably just as stiff in your other joints. You just don't notice it as much because that alarm system area can sense that stiffness a lot more, if that makes sense. Amy says, "How do our pets know where we experience pain at?" Well, Amy, you're one of my clients, so you know that this pain is both sensory, meaning we're feeling it in our body, and very emotional. Okay, so the emotions around our pain, the emotions connected to our pain, those are very intense. And, you know, anybody who's a pet owner knows that pets are very, very in tune with our emotions. So that's not a scientific thing that I'm saying. I think that that's just, my synopsis on why that might be. But I think pets can feel our emotions in certain ways, and I think that might be why they gravitate to the limb that is feeling our emotions for us. Okay. Catherine, I would like to know more about using ice. Until a few days ago, I was telling people using ice was a big no-no until you pointed out it was okay. All the information I read until then said no on Google and in books. I thought it damaged nerves. Yeah, Catherine, great question. Ice is not the devil. I see it a lot in groups that ice is a something that causes spread, or ice can injure you in certain ways. The only way ice is going to injure you is if you're keeping it on all day, 24/7, or you're keeping it extremely cold. When you do something like that, the reason ice is dangerous is because your alarm system, your sensory system, is not interpreting input uh, properly. So the ice might be super cold, and because your limb is so hot, you don't notice how cold the ice really is. So then you can end up with, some sort of frostbite or some type of skin irritation from the ice. So if you're going to use ice, it's fine. Just use it for, 10 to 15 minutes. Have something in between your limb and the ice so that, it's not going to cause any irritation to the skin, and then leave it off for a while, and then you can reapply it again. I would keep, I would be careful about sharing information over and over again in groups, because some of this information comes from nonprofit organizations that are using this information that has been crowdsourced from people. Also, it might come from a website where they're just spreading what they've heard about CRPS, not actually like concrete research. Many people with CRPS come to me, and the only thing that is helping them is ice. And it's not causing it to spread or anything like that. And so I don't feel that ice is a dangerous thing. I think that if something is making it feel good and you do it in a responsible and careful way, then it's just fine. Going back to the concept of getting used to varying temperatures, if you are going to get used to cold again and go on to live a normal life, eventually we have to get used to the feeling of cold. And you getting used to ice is part of that. I myself was diagnosed with CRPS 10 years ago, obviously, and I do cold plunges every day. Okay, so that's really cold, and I'm getting into that with my body, and I'm fine. Okay, and so ice is not going to damage your nerves unless you leave ice on for a long time, or the ice is very, very, very cold. I In physical therapy school, we have to go through a human body dissection, a cadaver. I had to dissect a whole human body to learn about the body itself. When I got to the nerves, it was extremely, extremely hard for me to damage the nerve, even with a scalpel. Those things are very, very strong. And so a little bit of ice is not going to damage your nerves. That will not happen. Okay, so great question. I would be careful about sharing information around unless you actually have vetted the source that it's come from and found it to be accurate information. Okay. So yeah, this is part of the problem, I would say, with a lot of information when it comes to CRPS and a lot of the resharing and spreading of information. Okay, so this idea that ice is not useful primarily comes from Burning Knight's website. You know, if you Google right now, ICE and CRPS, you'll see Burning Knights and you'll see Harvard. And so right away, when you see Harvard, you're like, oh, then that's it. Ipso facto, ICE is a no-go. Actually, the reason that this became a topic and the reason that people started to feel like ICE was a bad idea is not because ice is a no-go for CRPS, and it's also not because ice is going to cause CRPS to spread. Spreading is a very complex thing. It has to do with the smudging of our brain's maps on our limbs. Our brain maps our limbs in a mirrored fashion from side to side. And I'll show that right here with the somatosensory cortex. As we are in pain, our brain's map gets more and more smudged. And so sometimes we get that mirrored spreading from one hand to another or from a hand to a foot because of the way the map is laid out in our brain. Additionally, when it comes to spreading, if you are afraid that it might spread, the nocebo effect, which I've shown before here in this video, applies. That it's very powerful. You might experience that spreading effect. In fact, when I first read about spreading and heard about spreading, the very next day I woke up and the pain had spread up my leg. I don't think that's because CRPS was spreading and it was just coincidence. I think it's because of my fear of it happening. With ice, I think there's a similar thing happening. People are afraid of ice. And when they read, don't use ice, ice is terrible on these images that we see on Facebook groups, they don't do further research, they get scared, and then it causes an adverse effect and it reinforces this idea. The reality is, even on Burning Knight's website, the only source that they are citing for the ice is a single case study, and that means they used one person. And that case study is talking about someone who did all day cooling of CRPS, of an affected limb. And if you are always cooling the leg and you don't have a barrier on your foot, then you will get frostbite or necrosis or problems with the muscles or joints. You don't want to use ice all day, of course, but using ice for 10 or 15 minutes when you have a barrier between your foot and the ice is typically okay, unless you have some other condition going on where you have, ulcers or clots or something like that. So clear with your doctor, but ice should not be something we avoid, especially if we're having trouble with temperature regulation. We should gradually get used to cold temperatures, just like we gradually get used to hot temperatures. Additionally, sometimes on these uh, images that we see on Facebook groups, they will reference Harvard, and they will talk about Harvard medical and how they say not to use ice. And there's no source again on Harvard's article. So when I go to Harvard's article talking about not using ice, they aren't citing a source at all. They're just saying that applying ice might be bad or might worsen symptoms for CRPS. They don't give a parameter, they don't give a protocol, they give nothing. And so going and citing Harvard makes it look official, but if you actually dig into the research, as I've done for the last 10 years, there's nothing there that is showing, uh, ice is absolutely bad. In fact, I meet a lot of people who have CRPS who say ice is the only thing that gives them any relief. And I've met people who have come into my office with CRPS when I've been at the hospital. This has happened multiple times, and they keep their foot inside of a bucket of ice because it's the only thing helping. What I would do is I would gradually wean them down from using the ice so often, but I wouldn't take it away or try to scare them away from using ice, especially if it's not causing damage to their limb at this time. So be careful with the information that you spread around and do your due diligence on the research that is there. A single case study is not a good metric for research because case studies have a ton of variables. It's only one person. I prefer systematic reviews or much more thorough studies covering a bunch of studies or having a bunch of subjects. So I have no problem with ice. I have no worry associated with ice. If you are using it sparingly in small doses with a barrier in between your foot and not too intense of a temperature, I see no issue with it at all. So thank you, Catherine, for being open, for learning that and continuing to learn and explore this condition. Yeah, I would just be careful with what we're sharing, even though we feel like we might be helping. Sometimes it might scare people in a way that isn't so good. All right, next question. Karen, I have my knee straight on my recliner. My foot will randomly go ice cold. However, if I bend my knee, my foot will warm back up. Is there a correlation for this? Yeah, Karen, if your knee is straight on the recliner, okay, then your blood flow is going back this way or just pooling in your leg. And then of course it's going to get cold if it's like that. And then if you go like this and you put your knee up, you bend your knee, the blood can come down the leg again and it'll feel warm. Okay, remember your nervous system in that area where your foot is affected is extra sensitive. So if we start to, have the foot straight and the blood just pools there and gets cold, you're really going to feel that. And when you lift the leg up, you will feel it get warm again. So that's totally a normal thing. If you want to move the blood in your leg without even having to bend the knee, what I would do is I would do a pump with your ankle like this. And the reason for that is because it's taking the muscles in your leg and it's pumping and contracting them. And as I've said in previous videos, it's pushing the blood up through the veins, through the vascular system, and bringing it down through the arteries, and kind of recycling that warm blood to keep the foot feeling good. Okay. Donna, hi Chase. My husband got me some herbal hibiscus tea last week when I was having a POTS flare up, and it seems to be helping and calming me. Are there any other natural teas, etc., that you would recommend? Thank you. Hey Donna, there's nothing specific that I would recommend. Actually, anything that you feel like is calming is great. So, for example, I really like vanilla candles because they remind me of my mom, and that makes me feel very calm. I also like chamomile tea before bed because it tastes good and I put honey in it. There's something to be said about something your husband got you. I know you love your husband very much, that he's caring for you in a certain way. And when you drink it, maybe it makes you feel comforted. It maybe makes you feel a little bit warm and maybe it tastes good. And what that's doing is it's calming down your nervous system. And so, yeah, of course, it's going to be helpful. But there's nothing specific that I would recommend or push to you when it comes to natural teas or natural remedies. Okay. So, overall, stay hydrated. If you want to get some electrolyte powder, here's a brand that I like just because it tastes good. That's great. Keep yourself healthy with nutritious foods, whatever feels nutritious to you. And yeah, just work on calming the nervous system. If the tea helps you do that, fantastic. I love it. Great job, Thomas. Jacob, what if you just have permanent nerve damage? What if the injury to your nerve or nerves is not ever going to heal? How can that be considered CRPS, or is it? I understand type 2 CRPS is with an injury, but at what degree of an injury? Yeah, Jacob, whether the nerve is damaged or not is neither here nor there. The process by which we help something that is extra sensitive and reacting to sensory stimulus improperly, so meaning we touch the area and it hurts a ton, is by desensitizing and getting it used to being touched. With an amputee, for example, they have permanent nerve damage. Their nerves have been cut. In some situations, their nerves have been blown off, and burned. But we do the same thing that we do with CRPS with an amputee. We use mirror therapy, we use desensitization, and we slowly expose that limb to different temperatures, pressures, touches, etc., and it gets better. Nerves are hyper resilient even if they're damaged, and so a nerve being damaged, it Does not matter. The nerve can adapt and intake sensory input properly again if we approach it in a slow and calm fashion. Okay, an analogy I like to use for this when it comes to CRPS is um, a stray cat. Have you ever seen a video of a stray cat or dog? And in the beginning of the video, the cat or dog is very skittish, very afraid. Oftentimes you'll see them kind of backed into a corner like this, like looking at the rescuer, like, don't come near me. I don't know what you're going to do. I'm afraid. And the rescuer, what do you think would happen if the rescuer just went up to that dog and just grabbed it or the cat? Well, the rescuer would get injured. The cat or dog would bite or scratch the rescuer and probably try to run away even further and slowing the progress. However, if the rescuer approaches this stray cat or this stray dog gently and calmly, sits down with it for a while, gives it some food, lets it smell its hand, and then slowly and but surely just starts to try and pet the dog or the cat. Eventually, in the videos of these strays, the rescuer is able to get the cat or dog, bring it into its car, retrain it in a new home, and then the video always ends with the cat or dog playing happily. No matter if the nerves are damaged or not, or the cat is or dog is malnourished or not, the process is always the same. We approach it slowly with love and care, and we get it used to touching and interacting again, and then eventually things get better. So nerve, this is a common question I get a lot, and I really love answering it. Nerve damage can happen, but people with nerve damage are not doomed to always have pain. We can reprogram it. In fact, only about 10 or 15%, I think, of amputees experience phantom limb pain. So that's straight up nerves cut, gone damage. And only about 10 to 15% of them experience that pain. And that pain gets better through the mere therapy and desensitization. So I hope that helps calm your nerves, pun intended, in this situation. But yes, the nerves can learn and adapt and overcome this stimulus misinput. Okay, Trisha, can you give tips, strategies for CRPS prevention for any future injuries or surgeries? Thank you. Yeah, so this is a common fear with CRPS that anytime you have another procedure, you're at risk of developing it again. I disagree with this notion. You might be at more prone to develop it again because your nervous system can get into this overloaded, hypersensitized position. And I've talked about this again in my re-explaining pain video that I mentioned earlier. But if you calm the nervous system by addressing the factors mentioned in that video, here's a chart from it. If you address the injury factors, if you address the factors of movement, if you re-educate yourself on how structure is not important when it comes to the body and pain, if you address your medical factors, with proper medications or weaning off medications, if you maintain a good lifestyle with healthy diet, healthy sleep, healthy exercise, and then you also reduce the stressors in your life and desensitize that nervous system, as you see on the chart there, if you bring that central sensitization down, then having a surgery or having a procedure or injury is neither here nor there. Your body won't be so hyper overloaded that you develop CRPS. To give you an example, I have tattooed my entire both my arms. I tattooed my chest. I lasered the tattoo off my chest. I've broken my collarbone. I've rolled my ankle. I've had a whole bunch of injuries. And I have not developed or had CRPS again. Okay. So a lot of times our fear and worry about it all might be happening. It has a nocebo effect, the opposite of placebo, a harmful effect in making us have it happen again because of the hyperactivity of our nervous system. And so I want to calm that fear as much as I can. You take care of your nervous system, you relax yourself, you calm yourself. These injuries or surgeries are not going to be a problem. Okay, Rachel. Hi, thank you for so much for doing these. They are invaluable. Well, thank you, Rachel. I know you can relate here. It's been indented to me, mind over matter, no pain, no gain. I need to be hit over the head daily to remind myself that's not how CRPS works. I have read the expectations effect and get it, but behavior changes so hard in this area. I'm like opposites. Train hard, but lots of calming, self-compassion, meditation, mindfulness. Any tips and tricks to help me get over this? I have the mindset that I'm still an elite athlete. Thank you so much. Yeah, Rachel, I totally get it. I want you to reimagine the scenario I said with the stray cat and dog. We have to slowly approach this stuff. And if you want to help your athlete brain to frame this, even Olympic athletes take rest. If you do not take rest, if you do not pace yourself with these activities, not only are you pissing off the stray cat or dog, or not only are you setting off that alarm system again, but you are hindering your future performance. So, right now, for you, for your body, walking 1 mile might feel like running a marathon for your body. So I want you to reframe what makes you elite. If you go and do 10 squats for your body, that might feel like 30 or 50 squats for my body. So I want you to think of it that way. Your workout right now is a scaled down version of what you used to do, but it's not going to be that way forever. Take rest. Don't set off your alarm every time you work out. Don't grab the cat or dog and get bit and scratched and think that you're making progress in this way. The road to recovery for this is a bit slow and it's not a straight line. This is actually what the road to recovery looks like. We will have flares, we will have ups and downs, but if we take our time, if we proceed slowly, if we let the cat or dog smell our hand or give it a treat over time, we will end up like the cat and dog at the end of the video, happy, playing, having a great time. So my tip and trick over this is, yes, you are an elite athlete, and elite athletes need rest, and they need to strategize about how to use their body to the fullest. Right now, using it to the fullest is taking rest and scaling down our activity, but it will not be forever. Okay, so you can do this. Madeline, hello Chase. Can you please discuss TMJ and carpal tunnel correlation with CRPS? Thank you. Yeah, Madeline, this is a great question. Um, with TMJ and carpal tunnel, we tend to carry a lot of tension in our bodies. Okay. We carry tension in our shoulders, we carry tension in our jaw, we carry tension in our hands. I want you to imagine what you would look like if you were angry and about to get in a fight. I will show you. Okay. So, see, my jaw, I clenched it as hard as I could, and I held my fists up like this. If we are carrying around a lot of anger in our life, a lot of tension in our life, whether it's due to our job, due to our home situation, etc., we will constantly, subconsciously be clenching our jaw and clenching our fists internally. In turn, we might start to have symptoms of TMJD, and where our jaw starts to hurt or pops. We also might start to have symptoms of carpal tunnel. Oftentimes, these conditions are blamed on things like posture, but posture is kind of a controversial myth of a subject in the physical therapy world. Or carpal tunnel is blamed on keyboards, but carpal tunnel incidences since the condition was named have gone up something like 600%, and it was always blamed on keyboards or computer desks. But we had typewriters for years, and there was no incidence of carpal tunnel. Okay, so in my belief, the correlation of carpal tunnel and TMJ with CRPS is a repression of the emotion of anger. And if we can kind of take a dive into what is making us angry and address that, oftentimes I see the symptoms of TMJ or carpal tunnel start to dissipate. Okay, and if you want a book that kind of discusses that, I will grab it 1 second. Then I would take a look at this book here. It is by a physical rehab and medicine medical doctor, Dr. Sarno, and I find it to be a great book. Hard to read because you have to come to some interesting conclusions and accept some things about yourself. But it was a book that changed my life in certain ways. So I've recommended that in this video, my top 10 books for overcoming chronic pain. And I would check that out and see what you think and see if it's helpful for this condition. But yeah, chronic stress and tension often lead to conditions like TMJ, carpal tunnel syndrome, POTS, AMPS, PANS, PANDAS, FND, etc. um, chronic fatigue syndrome, chronic migraines. They're all very interconnected. And that's why when you're in the support groups and you're in the forums, you see people saying, has anyone been diagnosed with POTS and CRPS? Has anyone been diagnosed with chronic fatigue and CRPS? They're all kind of the same problem. It's a nervous system, alarm system overload. And when we're running at 1,000% capacity all the time, it's no wonder we get fatigued. It's no wonder we have tension in our muscles, in our jaw, and our hands. It's no wonder we have episodes of uh, passing out or lightheadedness because our nervous system thinks that we're constantly being chased by a lion when we're just sitting in our living room. Okay, so calming the nervous system will calm the symptoms here, and taking a look at the emotions or life factors that might be causing these symptoms is usually the answer. Jen said, "Hi Chase, I see a similar theme going on. Can you talk about pacing and how to accept incremental change when you're used to pushing hard? Also, what are your thoughts on energy work like Reiki and Tai Chi?" Yeah, so I touched on the pacing. Again, even elite athletes take rest. Right now, your body thinks that a mile is 26 miles. And so we need to plan accordingly. If you continue to boom bust, meaning you go super hard with your exercise and then you have a flare in response to it, if you continue to do that over and over and over again, the same thing is going to happen over and over and over again. So you have to make the choice to approach this slowly, as if you're training for a marathon. If I wanted to do a marathon, I'm not going to go tomorrow and run 26 miles. I would need to start with something small. And so when you're retraining the body to get back to activity, we need to start with something small. Okay. As far as energy work goes, my general opinion on anything is if you have heard good things about it, if you think it will work, if you have seen it be helpful for other people and you're excited to try it, then try it. If you have heard bad things about it, if you're skeptical, if you think it won't work, if you think it'll make it worse, then don't try it. This is because of the placebo and nocebo effect, which I've talked about a few times, especially in this video, Watch Your Language. So if you haven't seen that one, that's another one for you to check out. Josiane, I'm so sorry if I said that wrong. I've had CRPS since 2009, but diagnosed in 2012. Why is it that my skin shows no signs of it? I have all symptoms, loss of bone mass, muscle mass, loss of toenail, ultra sensitive skin to the touch. My skin looks absolutely normal. Why? Uh, just depends. I mean, some people with CRPS have no color changes. Some people with CRPS have cold feeling instead of hot feeling. Some people with CRPS have um, just different symptoms in general. And you can have CRPS and have all or only three or just a few of the symptoms at any given time. CRPS is diagnosed by one thing and one thing only. It is the Budapest criteria. And the bone mass loss and the muscle mass loss are not due to CRPS. They are due to disuse of the limb itself. If we are not using a limb, if I have CRPS or not, and I tape my arm to my body and I don't use it, over time my arm will shrink and get smaller. Okay. So the fact that you don't have the color change, it doesn't matter. You can still have CRPS and have no color change, and that's just how it is. There were times during my journey with CRPS when I had color changes often, and times when I didn't. And so, yeah, that's why. Some people's alarm system reacts in one way, another person's alarm system reacts in another way. I like to think of it this way: it's the house alarm is malfunctioning so much that some people's sinks are turning on and lights are flashing. Some people's sinks don't turn on and their lights don't flash, but the alarm system is still malfunctioning for them. Okay, Deanna. Hi, Chase. I've been using ketamine compound since 2017. It helps some with the flare-ups in my feet and legs. What is your thoughts on having IV ketamine treatment when a flare-up is really bad? The doctors have talked about ketamine infusions for CRPS. Does it help, or would it be a waste of time for CRPS type 2? Hey, Deanna. So first thing, CRPS type 1 and type 2, there's no difference. And the reason I say that is because there's a common misconception that some things work for type 1, some things work for type 2. The only thing about the typing is they are saying that with type 1, you've acquired CRPS for an unknown reason. There was no potential damage to a nerve. It's just had insidious onset. That's type 1. Type 2 is you've had a surgery of some sort and there's possible damage or causalgia to this condition of CRPS. That is the only difference. It tells you how you got it. Either no nerve injury, no nothing, insidious onset type 1, or there is an injury, there is a potential cause, again, causalgia. That's type 2. Okay. Additionally, when it comes to ketamine, I don't mind it at all. It is a tranquilizer. It makes you tranquil, it makes you calm. And again, through this whole video, I've been talking about calming that alarm system, calming that nervous system down. And if ketamine can do that for you and you enjoy ketamine or you've heard people that have had success from ketamine, that's great. I have friends that get ketamine infusions for mental health reasons because their nervous system, it's called nervous for a reason, is hyped up because of traumatic events in their life. They don't have CRPS, they don't have pain, but it helps their mental health as well. And I also think that's a big reason why ketamine is helpful for CRPS too, because our nervous system gets amped up by a lot of things, not just our medical journey, but also our mental and emotional journey as well. So yeah, give it a try if you've heard good things. I don't think it would be a waste of time. You might try it and it might be helpful. That's awesome. It should be a bridge to get you where you want to go, not a road. This should not be a lifelong infusion journey. Okay. It should be a bridge to get you back to life and activity. Hey Chase, I have a question for the next Q&A. Diagnosed with CRPS after a minor surgery I had on my right foot in 2022. Before this procedure, I had nerve pain for years due to Morton's neuroma, but after procedure, the pain has only gotten worse. The pain only goes away when I sleep, but as soon as I put my foot on the floor in the morning, it comes back. My question concerns the effect of temperature on my foot. For example, when there's no underfloor heating in certain rooms, the pain is unbearable. With heated floors, it's reasonably good. Shoes are difficult, with the exception of a few brands. I prefer to not wear socks. That feels really bad. No specialist, and I've seen a lot over the years, has been able to explain what temperature does to the nerves in your foot. In the summer, when the underfloor heating is off, I walk around the house on crutches. Can you perhaps explain what happens with cold and heat? And thanks so much for all the helpful information you've shared with us so far. Yeah, so I've already kind of covered this, but right now you are having difficulty with temperature sensation, and it sounds like heat is helpful and safe for your alarm system. What is not helpful and safe, what it looks like, is weight bearing, um, cold or room temperature floors, and socks or certain shoes. So this is what I would suggest. I would suggest gradually approaching being able to bear weight through your foot. So if you're using crutches, what I would do is I would actually hold the crutches like this, and I would have both feet on the ground, and I would try to every now and then take a little bit of a step using the crutches as help with the foot that is affected. We need to get used to that motion of stepping again, and you can use help from your crutches as much as you need to. But over time, I want you to put more and more and more pressure on the foot so you can get used to that pressure. Additionally, if you're trying to get used to cold, I would start to use something maybe like a heating pad. We could get a heating pad, place it on the floor, get one that has varying levels of heat, okay? And start at the top. And then each day work down and down and down to less and less heat. So your foot starts to get used to having the heat there and then not having the heat there. And then eventually you could even step on something like a cool pillowcase, and in the mornings to get used to that cold feeling on your foot. When it comes to not being able to wear certain shoes or socks, I would start applying pressure to your foot to get it used to wearing something that gives pressure, like a sock or a shoe. The way you could do that is you could get a sock that is one or two sizes too big, and then reduce the size until you get to your size again. Another thing you could do that I have clients do often is take a blanket for maybe 10 minutes a day and wrap it around your foot in such a way that it's creating tension or pressure on your foot, and get used to it. You can do it for 10 minutes or 10 seconds, it doesn't matter, but it's something you build up to. With socks, again, it might feel really bad, but can you wear the sock for 30 seconds and then the next day 35 and then the next day 40? Can you approach these difficulties that you're having with temperature, weight bearing, and sensation in such a way that it becomes less and less difficult? Okay. Again, if we want to run a marathon, we're not going to go run 26 miles. If we want to wear socks, we're not just going to slap socks and a really tight shoe on our foot. We need to work up to it slowly, safely, keep the alarm system calm, and keep the stray dog and stray cat happy. Okay, I hope that makes sense and is helpful to you. If you need to know where to start with desensitizing your system, check out this video, desensitization, where to start. It's a good explanation of how to truly do desensitization. I think that'll be helpful for you. Great question, great question. So yeah, check that out. Okay, Nana, what I don't understand, mine is cold CRPS. I'm not injured. It's in the brain after severe ankle sprain on my whole left side. So I'm indoors. Everything okay. Then I go into cold weather and my leg sees it up and stiff pain within a 10-minute walk. Why? I just don't get it. Uh, well, there's a few things here. There's a 10-minute walk. Okay, so is that how far you're normally going when it's warmer outside? And if so, that's great. Right now, again, just like I've mentioned with a few other people, for whatever reason, your alarm system is sensitive to cold. I would also consider, when it's the cold season, what's going on in life. A lot of people get heightened pain in the cold season because they go and visit their in-laws. And, I laugh when I say that, but it's the truth. Remember, personal factors and stressors outside of the feeling of the cold can be a big component of our pain. So I would ask yourself two things. What is going on with the cold season, that time of season when I'm having this extra pain and this seizing up? Is 10 minutes my normal walk time? And if it is, and in the cold I can only go for 10 minutes, maybe in the cold we start with 5 minutes instead. And then additionally, how can you start to approach cold being tolerable again? Um, by potentially exposing the limb to cold. So again, cold pillowcase, maybe a cold washcloth if you feel okay of putting it around your foot, and then a damp or cold washcloth, and then maybe turn the temperature inside down a bit, turn the AC on, and get the house cold in a controlled fashion. You can make it colder and colder and colder gradually to get you used to that cold. That's the same thing I had to do with my cold plunge. I couldn't just jump in at 38 degrees. I had to start at maybe 65-degree water and then slowly lower the temperature down. And that's with my body that's not experiencing the pain of CRPS anymore. But I had to work up to that cold plunge temperature, and now I can sit in it, at 40 degrees for 2 minutes. Whereas if I would have tried that in the beginning, I would have got 10 seconds in and been shivering for the next hour. Okay. Wow. It looks like that is it. So, thank you guys so much for watching. I really appreciate these Q&As a lot because I can jam pack it with information just like I did today. I'm excited for the next one, and leave a comment below for more questions. If you're unaware and if you're finding these videos helpful, please do visit my website and join my email list. The website is thewindowpane.com, and you can see my email list there. Additionally, I do offer 8-week online self-guided programs for CRPS. You can join anytime and you'll have lifetime access for as long as the course is up to refer back to the information in that course. These videos are just a small sample of the depth that I go into in that course. And so, please do check it out. And then lastly, if you're looking for more tailored guidance, one-on-one guidance, you can again go to thewindowpane.com and click the schedule a free consult button there at the bottom, or the consult button. And you can get set up with me for a free consult so you can learn about my one-on-one pain coaching, where I use my professional experience as a doctor of physical therapy and pain specialist on top of my personal experience of having and dealing with CRPS, combined with psychological techniques such as acceptance and commitment therapy and cognitive behavioral therapy to help you move forward to a more meaningful and fulfilling life. So if that is something that interests you, go ahead and schedule that consult. Otherwise, I will see you guys in the next video. Thanks.